So thank you all for being here today. It is both an honor and a responsibility to welcome so many engaged community members, experts, and leaders to this important conversation. Thank you all for showing up, for caring deeply, and for being part of a conversation that matters not only to the future of our state, but to the lives of children and families right now. I'm Kathy Taylor, president of Connecticut Community Foundation, and I am so glad to have you all at this forum. Is Connecticut a great place to be a child? This title is both a question and a challenge. It invites reflection, accountability, but it also invites action. The question we've gathered to explore is simple on its face, but profound in its implications. How we answer it says everything about who we are, what we value, and what kind of future we are building together. We know that far too many children in our state and across Greater Waterbury and the Litchfield Hills, for too many of those children, the answer right now is no. It's not a great place, not yet. Rates of child poverty remain indefensibly high. Racial and economic disparities persist. Access to stable housing and nutritious food and early learning and mental health support is uneven and too often determined by zip code rather than by need or potential. At Connecticut Community Foundation, we believe every child, no matter their zip code, their background, or income, deserves the chance to dream, to learn, to be healthy, to feel safe and supported, and to thrive. We also recognize that opportunity is not evenly and equally distributed. But we also know something else, that change is possible. Communities like ours, we're not standing still. You all are here on a Friday morning. You could have taken off and went to the beach, but you're here because you care deeply about creating opportunities, equity, and belonging. We have our marching orders. Many decades ago, President Lyndon B. Johnson stood in the Capitol on January 8, 1964, and in his first State of the Union address, committed the nation to a war on poverty. If you've never read that State of the Union address, I encourage you to Google it. What he said, "We shall not rest until that war is won." Now, it's interesting because he's talking about this at the height of the Vietnam War. And so he goes on to say, the richest nation on earth can afford to win this war, but we cannot afford to lose it. At that time, about 1 in 5 Americans were living in poverty. Here in Connecticut, 61 years later, nearly 1 in 10 children grow up in poverty. When Lyndon B. Johnson announced this unconditional war on poverty, he called it a national disgrace that merited a national response. Those are powerful words. Unfortunately, those calls went unheard until the COVID-19 pandemic brought the issue to the forefront. The pandemic served as an unprecedented global crisis, but it also revealed the profound impact of targeted government assistance in alleviating poverty. These programs that were implemented then, emergency food aid, the refundable child tax credit, we saw a dramatic decrease in child poverty across the United States. In Connecticut, when the federal government provided $2,000 to $3,000 in child tax credits per child, not $250, child poverty was reduced by nearly 70%. That's within all of our recent memory. But yet all of these key pandemic relief programs expired. And when they did, child poverty went back up. And that's why Connecticut Community Foundation joined the pledge to end child poverty now, because again, we believe that every child deserves a chance to not just survive, but more importantly, to thrive. The pledge to end child poverty now is not a lofty vision in the future. It is a call to action today. Today you will hear from local and state leaders, advocates, and lived experts who are confronting the root causes of child poverty head on. We hope their insights spark ideas, challenge some assumptions, and inspire new collaborations. Today, this is a moment to not only observe, it's an opportunity to learn, but also a moment to reimagine and to act. Let's use today to listen deeply, speak honestly, and stay curious. And let's leave here recommitted to building a state and a greater Waterbury and Litchfield Hills that truly is a place to be a kid. Not for some, but for every single child. And with that, we will have a brief data presentation from Mark Abraham, Executive Director of DataHaven, followed by a moderated panel. Welcome, Mark.
Thank you so much, Kathy. We appreciate the Connecticut Community Foundation's support for DataHaven programs. And when we launched our recent survey last year, we were brainstorming, before it launched, about the idea of a community event to share that information back. So I'm really appreciative to Kathy and the CCF staff for making that happen, especially with the relevant theme of child well-being at this time. A little bit about myself. I've lived in New Haven since 1998. And my favorite place in Connecticut is the Moraine Trail at the end of Hammonasset State Park, where my 3 kids can scramble over the 20-foot high boulders, hopefully not fall into Long Island Sound. But we go there multiple times a year for them to run around those boulders. So a little bit about me. And yeah, so about DataHaven, we're a nonprofit. We're about 31 years old now, and our mission is to ensure that all communities have access to information about well-being, equity, quality, and quality of life, which are the issues that are most meaningful to those areas, which aren't always captured in, say, census data or economic data. We mean people with different life experiences, like who have a disability, who've had incarceration experiences, and others. So we try to collect all that data, given that it's not typically available from other data sources. DataHaven has worked in the greater Waterbury area since about 2015, and we just completed projects for 3 different health systems in the Waterbury, Litchfield Hills areas just in the past couple weeks, where we talked with residents throughout towns in the region and looked at data to inform those hospital community improvement plans. Now, our largest program is the DataHaven Community Wellbeing Survey that has interviewed about 52,000 randomly selected adults in every town in the state since 2015. That includes interviews with more than 6,000 adults in the greater Waterbury area. Each interview is like the story of someone's life. It's a very detailed, in-depth discussion of economic issues, community issues affecting children, et cetera. If you're here from a nonprofit, you can also reach out to DataHaven for technical assistance. We do provide that assistance as well. Now, what I'm about to show you, I think, speaks to the importance of the panel today, but it also might be a little bit shocking to some of you. Researchers at the Yale School of Public Health a few weeks ago released a study, and the NBC News headline was that life expectancy for women has barely budged in the past 100 years. So you may have seen life expectancy studies before, but this one is unique because it's the first to provide comprehensive mortality trends by year of birth or birth cohort. And that's a groundbreaking way to really understand how state-level policy changes can impact people over the course of their lifespan, from birth to older age. So what this shows is that in Connecticut, the lifespan for women rose by 12 years over that time, from 75 to 87. In Oklahoma, the lifespan for women dropped by 1 year. So you can see that in the chart there, hopefully. In 2020, a different study, kind of a more traditional study, showed that 50 years ago, Connecticut and Oklahoma had the same life expectancy as well. You can see that on the left. There, 1958, about 71 years was the expectation. And if you fast forward to 2018 on this chart, if you look at the blue line, Connecticut goes up to be one of the healthiest states, and Oklahoma is now one of the least healthy states in the nation. So you might ask, how did that happen? Why are we talking about Connecticut and Oklahoma anyways? It seems strange. So these two states, I'll tell you in a minute, but these states have similar demographics. You could see about 61% white, about identical unemployment rates, Medicaid rate, and voter registration rate. So this chart of policy liberalism scores, it's a little hard to see, but I'll explain it. This is why the Syracuse study highlighted these two states in their chart, the blue line and the red line. And what it shows is that basically Dr. Montez and her team, she looked across 135 different policy areas and every piece of legislation that had been passed in those states over that time. The topics were, policies that affect people, like gun control, they're listed here, tobacco control, labor laws, immigration laws, et cetera. So they quantified all of that, and they found that of all 50 states, Connecticut passed the most progressive legislation of any state in the whole country, whereas Oklahoma went the farthest in the other direction. So you can see there again the blue line, Connecticut and Oklahoma, going in opposite directions on those quantifications of those laws. So when reflecting on how life expectancy has diverged so much in our nation, at least starting here at the state level for now, it's important to think about why these studies show that the changes in well-being over time particularly affect women and children more than men, and why so much more than men. You might imagine how policies like paid leave, family leave, child health insurance, like Husky dental insurance, and some of the others listed here, are of greater relevance to women and children. And this quote from the Syracuse study describes that. But we should also, gender equity is super important. We should also think about how these policies have a disproportionate effect on immigrants, on people with disabilities, and other groups from state to state. If we aren't considering equity in all policies, you can see that we're stifling our ability to be the most innovative and most healthy and productive nation. To demonstrate this, it's another chart. Now this one's even harder, so I apologize, but consider that in 1980, the US and the wealthy countries in the rest of the world had about the same life expectancy and spent about the same on healthcare per person. You can imagine, this blue line is a group of like Canada and the UK and other countries, but you can just imagine that as Canada for now, because they're all about the same. So they all had about the same life expectancy, spent about the same on healthcare. But as this chart, this is from KFF, as it shows, we now have the lowest lifespan of any high-income country, even though we spend twice as much on healthcare of anyone else. So we spend $13,000 per person, that's on the right. Canada, let's say, spends about $6,000 per person. So in summary, these data really show that there are places and systems in our country that are failing to support well-being and healthy lifestyles, healthy lifespans over time. More than just statistics, of course, these numbers represent individual lives. So when we look at life expectancy, we look at the actual records of individual people. We read about those in news stories, and these are people's lives and potential cut short every year. But to some degree, I include this because Connecticut is really a success story. You saw that it's now one of the healthiest states. And in fact, if everyone in the nation had enjoyed the health benefits of states like Connecticut that had adopted more progressive policies, the United States would likely be near the top of this chart on life expectancy. So of course, there's a big catch here. We're talking about Greater Waterbury, right? So if you take a look at this map, you can see that going just a few miles within the Waterbury region changes people's life expectancy by 15 years. And this is a much bigger difference than the difference between Connecticut and Oklahoma. So it's not just the policies of your state that matter. Policies are important. I love living in Connecticut, and a lot of great things have happened here. But what's really important is whether the benefits of those policies, do they reach everyone equally in our state? And this just, this shows Waterbury and Woodbury, and then within the neighborhoods, in the map, you can see life expectancy would vary even more within Waterbury. So for example, Connecticut on average has greater access to dental care, more people going to see the dentist every year than any United States state. We're very proud of our teeth in Connecticut. I like to say, I don't know what else to say about that, but it's just an interesting fact. The community level data, though, this shows that dental visit rates in parts of Waterbury are about 38%. And most of the other towns all around Waterbury, the rates are about 75, 80%. So again, not everyone gets the same mileage from the progressive laws that we have. We have, dental care, et cetera, but, there's unequal access to those for various reasons. So what this shows is we need to have the courage to, break down the data within our communities, look at who's really doing well, who's not. Now, innovating to change these conditions, it starts with listening to people. So at DataHaven, as I mentioned earlier, we've completed live interviews with over 52,000 randomly chosen adults in the state and also many focus groups. We asked residents directly in our survey if they feel their place is a good place to raise children. Actually, that's the wording of the question. So you can see the results here, and these are in your programs as well. There's more detail, I think, in the handouts that you have. But you can see when we ask people, is your town a good place to raise children? About 2/3 of folks in Connecticut and in Greater Waterbury say that it is, or say that it's good rather than fair or poor. In Waterbury, 29% of adults say that the area is a good place to raise children. And these are randomly selected people. We then weight the data to be representative of the population. So these are very reliable statistics. They're very labor intensive to collect and weight the data to be accurate. And then there are other indicators here that are associated with that question of is the area a good place to raise children. One thing that's surprising is one of the things that's most linked to that question is a question about whether people had to stay home because they didn't have transportation. So the more people who have to stay home because they don't have transportation, the more likely those individual people are likely to say that they think the area is not a good place to raise children. So just the idea of being able to get around your community, particularly the big issue in Waterbury, you can see where 30% of people couldn't get around, had to stay home from doctor's appointments or other places just within the past year. Food insecurity also is very high. And then these are some of the other measures in the survey, like trusting neighbors, having good quality parks. You can sort of imagine two moms, one in the suburbs who has great parks, ease of transportation, another in Waterbury, and some of those zip codes, the food insecurity rate, in other words, people who ran out of money for food or ran out of money to pay for housing, those rates could be 6 times higher in those areas. So we see radically different futures for families, even within the same state. Another factor that affects how people perceive the area as a place to raise children is actually home ownership. And from the equity report, which is also a handout in the front today, you can grab a copy. This slide shows the tremendous differences in home ownership rates in the region as a whole, and this is by race, ethnicity, and age. So you can see for folks of sort of who may have children, maybe age 35 to 64, the home ownership rate for white adults in the region is 81% versus less than half of Black and Latino adults in the region owning homes. So home ownership is important. Transportation, issues around racism and discrimination, which we also measure in the survey, those are certainly factors as well. So these data may be sobering, but the bright spot here is that people do use this information to influence the funding that comes their way in their communities. We've seen actions backed by these local data to reroute bus routes to suburban jobs, secure funding for food pantries, get large federal grants for your youth programs. This data really highlights the needs in those areas. So again, thank you to our partners here for supporting the data collection. And you might ask from our survey, what trends do we see over time? One of the biggest trends that we see over time in our survey since 2015 is the rise in the number of people who run out of money for housing. That's increased from 6% of adults in 2015 to 12% of adults today. Sounds like percentages can sound small, but that's really hundreds of thousands of people in Connecticut who just within the past year ran out of money for their housing bills. Another really important trend, and Kathy alluded to this, is food insecurity. Similar to national surveys, we saw that in Connecticut, food insecurity rates hit an all-time low in 2021, which was when the child tax credit was expanded. And particularly for families, you can see when that ended in January of 2022, the food insecurity rate almost doubled. So people, who had food, they were running out of food, basically as soon as that credit expired. There is a report on the DataHaven website looking at the Connecticut legislative proposal to create a $600 tax credit for children. And this shows that that credit, for example, it would benefit over 12,000 families just within the city of Waterbury. It would bring $14 million per year that those families could spend on childcare, summer camps, housing, other things, and relieve stress that really affects children and families. If you look at your program for today, as I mentioned, there's some additional data on how these vary by demographic. This is another slide that we sometimes use that shows, other life experiences that are important. So if you work with people who had different experiences of incarceration, have disabilities, the food insecurity rates really vary, even more among those groups. To create these local data in our survey, we ask these questions. The communities that we work with across the state, they help us prioritize these questions, and because they're the most important. So our survey is somewhat unique in asking about these life experiences like migration history, incarceration experiences. They're not included in most population surveys. So in summary, it is critical to ground truth these data by talking with residents, but I like the data collection, but my favorite work is the focus groups and kind of the one-on-one meetings with people from different parts of the state. We need to make sure that everyone has access to this information and the ability to present it in their own words to influence the funding, the policies in their areas. And that's where all of you come in, I think. You can visit the DataHaven website, you access these reports. I know CCF generously printed out a couple as well. Help us connect with stakeholders who could benefit from this information in communities that are in the Waterbury area. So please reach out to us if you're able to help with that, and also use the information in your work to influence changes in systems in the area. Again, innovation in well-being, it starts with respecting, listening to communities, and ensuring community voice. So I look forward to the discussion today with my fellow panelists, and I can't wait to hear more about your ideas to make Waterbury a healthier and better place for children. Thank you. Thank you.
Thank you, Mark, for that rich data presentation that really does illustrate that within our region we still have work to do. As an attorney, it reminded me that laws have real impact, that they matter, and that they have consequences. It also reminded me of another thing, that data is really important, because if you can't get the data, it's really difficult to argue for policy changes. And so I say that to say, data is important. Thank you, Mark. We all use it. And research is important because that research gives us a bit of knowledge, and that knowledge gives us power to impact real change. And so with that, I now invite Ginny Monk, the children's issue and housing reporter from Connecticut Mirror, who will moderate the discussion for us. Ginny?
All right. Thank you for that introduction. On Mark's comment about the teeth, as someone who came from the South where there's a lot less access to dental care, you all should be very proud of your teeth. Yeah, Mark, I'm so excited he's here today. He single-handedly makes my job a lot easier by giving me statistics to write about, so thanks for that. So good morning, everyone. It is good to be in Waterbury this morning. I had a chance a couple of years ago to come out to spend some time with kids at a story time with Nest. I think some Nest folks are here somewhere. Yay! We talked about their schools, where they lived, what they loved about their neighborhoods, most importantly, their favorite Frozen characters. At that time, I had all of them start with 30 seconds of dancing to get their wiggles out. I thought of making you all do that, but I suppose I'll spare you so we can get to our panelists. I am always excited to be in a room where there are lots of people interested in talking about the ways we can make the world better for kids. The past few years, we've seen a lot of big changes for kids. We've seen the expansion of our nation's child tax credit that lifted 61 million children in our country out of poverty and then threw them back into it when we revoked that policy. We've seen child care and housing costs rise. We've continued to struggle with the impacts of the pandemic. But I think hopefully we can talk about some hope today. I think we've just come out of the legislative session and seen kind of an increased focus on childcare costs, particularly some big housing legislation. So I'm excited to talk about those things today. There's a quote from Alexander Chi that for me describes why I write about the issues that I do. It's, should you decide that writing is your way to serve your country or to defend it, you're almost always writing about the country it could become. So, I do a lot of that writing because I love my country and I want everyone to have a good experience of it. But today you'll hear from folks who do that big work to study and think about the policies that make our country what it could be. They engage with their communities to learn what people need, then advocate for those policies to make it happen. So, without further ado, I'll introduce our panelists. All right, first up we've got Rashida Rattray, Education and Outreach Coordinator for the Connecticut Fair Housing Center. Rashida is a passionate advocate for housing justice and a dynamic public educator rooted in community empowerment. Since joining the Connecticut Fair Housing Center in 2020, she has led statewide education and outreach efforts with clarity, creativity, and conviction. As a graduate of Trinity College with a BA in sociology, Rashida combines academic insight with on-the-ground experience to advance fair housing rights across Connecticut. With a background in foreclosure prevention, legal administration, and municipal engagement, Rashida brings a deep well of knowledge and an unwavering commitment to every space she enters. Just having worked with Rashida a couple times, I can say that that's absolutely true. Next up, we have Emily Byrne, the Executive Director of Connecticut Voices for Children. Emily has extensive experience in developing human-centered policies and programs, as well as driving effective advocacy strategies in service of systemic and cultural change. Emily has led and contributed to work that has been recognized by past White House administrations and has appeared in numerous publications. Emily was the founding executive director of New Haven Promise, a nonprofit at the intersection of education and economic development. A public servant by training, she started her career as a policy analyst for the city of New Haven, Connecticut, where she helped design the nation's first municipal identification card for residents irrespective of immigration status. Since then, Emily has held various governmental leadership positions as a systems entrepreneur within the social and economic justice arenas. Emily earned an MPA from New York University's Robert F. Wagner Graduate School of Public Service. Emily and I are both coming off of the legislative session, so we're possibly a little sleepy, but I don't think that'll slow her down. All right, next up we have Chelsey M. Harris, Director of Early Care and Education for Waterbury Bridge to Success Community Partnership. Chelsey is responsible for co-facilitating the Early Care and Education Collaborative Action Network to bring together parents, children ages 0 to 8, and organizational partners by providing educational and community resources and support to support child development. A daughter of Waterbury and a graduate of Wilby High School, Chelsey is driven by her love for children. She works diligently to ensure educational equity for all Black and brown children. She also is engaged in the advocacy of Black maternal health to support an all-around equitable environment for all women. Chelsey credits her heavy involvement in the community to the Connecticut Food Bank and the American Red Cross, where she has served as a volunteer for many years. This is my first time meeting Chelsey, but I'm thrilled. All right, so we're gonna get started. There will be a little space at the end for some questions. I will tell you ahead of time, I'm very strict about actually ask a question, please don't make a comment. So let's get started. So let's dig a little bit more into the current landscape of child poverty in Waterbury, the surrounding towns, and across Connecticut. What does the latest data tell us, and what trends or disparities should we be most concerned about? Chelsey, why don't we start with you, and could you speak specifically to Waterbury? I think that might be helpful.
Sure. Hi, good morning, everyone. So thinking about some of the trends and disparities that we've been seeing in a lot of the parent surveying that our org does, we also have community action plans in place that we're working on in partnership with Trinity Health and also Waterbury Hospital that we're currently doing. We're tending to see that housing obviously is huge. A lot of the surveying and community action plans that we're doing is finding, of course, that housing is a big issue, and so I'm glad that we're talking about this in tandem with early care and education. But some of the things that we have been seeing is that it is also relating to the bigger picture of kindergarten readiness, chronic absenteeism, food insecurity, which was mentioned as well, and lack of early care and education care, which definitely relates back to transportation and things like that. So from the housing perspective, which is, kind of the focal point here, everything is related to that in a cycle. And so when you think about why kids aren't showing up to school if they don't have somewhere safe to live, that's not really the concern of the parent at that point. They're trying to find somewhere for their child that's safe. And so when you think about folks who are facing food insecurity, if they don't have anywhere to live, how are they going to focus on doing that? And when you think about things like food giveaways and give backs and things like that, and things that are provided, sometimes the families don't have anywhere to cook these items. And so people are doing things that are not they intend to be helpful, but sometimes they just don't actually wind up being that way. And so I think that that's a big part of it. And of course, the transportation piece is huge as well, with folks not being able to get around the city. There is public transportation, but it is not adequate. And sometimes people are taking 2 and 3 buses just to get to a doctor's appointment or get their child to school or get their baby to the doctor. And so if there's bad weather or if one of the other kids is sick, one kid's not going to school because what am I going to do? And so those are some of the realities that we're really seeing here in the city.
Yeah, I was interested in what you said about kindergarten readiness. What are the things that families who are housed and maybe in a stable economic spot, what are the things that they can think about to get their kids ready for kindergarten that maybe families struggling with poverty just don't have the time or space for, like you said?
So I think everyone in this room knows that the cost of early care and education is astronomical. And I know we're going to get into some legislation later that is potentially going to be able to help with that. But families who are in stable positions, sometimes it's lack of awareness, and sometimes it's fear. We see a lot of fear where if people have a grandmom at home, right, or their aunt stays home, they'd rather leave their child with the aunt or the grandmom than sending their child to an early care and education center. So I think there is a lot of stigma around that, especially for Black and brown folks in the city. They're very concerned about where they are putting their children. And so I think that that's something that could be the issue there. But also the importance of what early care and education does. I don't think that people put enough focus on how important it is. I think it's a lot of talk about K through 12. Kindergarten is really important. Have your child in kindergarten. It's required. But no one ever talks about the early stages between 0 to 5, when that is the most important time for brain development and for children to begin to develop and hone their skills. So there's a lot of kids that are coming into our kindergarten system that are unprepared, right? And so then when they're getting there, the testing, of course, that we're using is also not culturally responsive. And so folks are then being misread and misplaced into special education, or we're putting them in other programs that they don't need to be in, all because they lack that early care and education. They don't need help. There's nothing wrong with them. They're not broken. They just haven't had access to that early care and education, which is extremely, extremely beneficial and important to their development.
Thank you. That was really helpful. Emily, can you maybe zoom out and give us a statewide look? Are things similar across the state to Waterbury?
Absolutely. Good morning. Just a little bit about Connecticut Voices for Children. We're a research and advocacy organization. We do both state and federal work. And so our goals are to eradicate child poverty and advance family economic security. And so I will provide some Connecticut context for sure. Last year, we published a report at Voices that's focused on poverty overall within the state and nationally. And Mark talked a little bit about this in his presentation, but in Connecticut, the supplemental poverty measure based poverty rate in 2022 was 12.1%. That's roughly 423,000 residents, and that was up from a low of 8.4%, roughly 294,000 residents in 2021. For children, we were talking about 11.6%, up from a low of 6.8%. And this is to just say that the policies that a lot of us are going to be talking about do work. We see the dramatic shift. I wanted to just provide some data around, what does it mean when we talk about official poverty measure versus supplemental poverty measure, because I think we throw these, words around and people don't really know what that means in terms of dollars and cents. The official poverty measure is 100% below the federal poverty level. And in terms of dollars, that actually is a range between it's a very low range. So what we are trying to do at Voices is factor in geographic location and whether or not you're a renter or a homeowner. And so we are trying to really force the state to look at supplemental poverty measures. And when you look at supplemental poverty measures, it's a range of $25,120 to a high of $47,890. It's not a lot of money. When we think about near poverty, that's between 100 to 149% of the federal poverty level. We're talking about $37,690 to a high of $71,830. It's still not a lot of money, and especially when you consider that this is for a family of 3, 1 adult, 2 children. So that many mouths to feed, right? That many people to house. We're not talking about a lot of dollars. And when we think about, what are the things that research tell us that dramatically reduce poverty, things like housing, things like food assistance, things like healthcare, right? And think about not just the state context, but also what the federal government is doing. We're not that much further. I mean, I think the really dramatic point of looking from the 1900s to today, time is both finite and fluid, right? So, I say this a lot. Not too long ago, we were, transportation was horse and buggy. Now we're talking about automatic, selfless driving cars or whatever. And based on the politics, we can see policies progress or regress, and we're starting to see that regression, not just in the nation, but we have the potential of really backsliding in Connecticut as well. So I'm really interested in the conversation, and I think I'm going to stop there.
All right. Rashida, I know you spend a lot of time out in the community. I mean, what are you seeing and hearing from folks as far as the landscape of child poverty?
Good morning. So a little bit about the Connecticut Fair Housing Center. We're a statewide civil rights nonprofit. A lot of the work that I do is really rooted in community outreach and education. So sometimes, we have these instances where we do tabling events or office hours at different organizations across the state that do have connection with community, with tenants, with homeowners, with residents. A lot of what we're seeing echoes what my fellow panelists have been talking about. But really, I've been hearing people just talking about the rising cost of living and how these housing costs are outpacing wages because wages have not caught up with the cost of housing. A lot of individuals have been desirous of policy or legislation that trends towards rent caps, where their rental, the amount that they can be charged or their rental charges increase would be capped at a certain amount, because right now we don't have any legislation that backs that. So, homeowners, landlords, housing providers have been able to raise rents astronomically, and individuals unfortunately have not had the wages to catch up with being able to supplement that. Of course, we talked about the child tax credit expansion and how that rollback has worsened families and family hardship. But a lot of what we're seeing is people just do not have the wages to support the rising housing costs, the rising food costs, and they're really trying to lean into their communities, trying to find mutual aid where they can, and just trying to supplement their income in whatever way that they can. So that is the most far-reaching cry that I hear in our community work.
Yeah, I think that's actually a really good transition into our next question. I was hoping to dig a little bit more, keep your mic, into the housing crisis. I mean, what are the biggest barriers to finding housing, keeping housing that you're seeing as you talk with folks?
So we found that, individuals, one, do not know their rights around housing, which is a very big thing, right? Because if you don't know your rights, you're not able to enforce those. And when someone is infringing on those, you're not able to identify that there's an infringement there. So sometimes individuals are not educated about the eviction process, for example. And because they don't have that education around the eviction process, they kind of fumble it a little bit. We are a right to counsel state, thankfully, but there are some people who are not even aware of how to access right to counsel. So there are those educational gaps that we see that, kind of prohibits individuals from being able to access fully the resources within the state. Then we also see discrimination that happens across the state. We have been in business since 1994, and it's not slowing down, unfortunately. So housing discrimination has been shape-shifting. Where we used to see more blatant housing discrimination, where it was posted in newspapers, we're now seeing more algorithmic bias and tenant screening being influenced by AI, which is a little bit harder to detect. We do have agencies and researchers that are on the ball, right? We have the National Fair Housing Alliance that has a responsible AI group that is currently researching these trends and cases that have been litigated where we've seen that tenant screening biases happen. But these are things that are happening that can be unknown to individuals who are going out to search for housing, right? All of the applications seem to be online. So you submit an application, you submit a fee, and sometimes you don't hear back from that and you're not sure why that is. So those are some of the barriers that we see. In addition to, we just don't have the construction, we just don't have the housing stock. The last time I checked, we needed 244,000 units to match the need of what we had housing-wise within the state. So we don't have the housing stock, and Connecticut's zoning laws are quite restrictive. So where housing can be built and who can access housing where it's built can be strained throughout the zoning process. So there are a lot of different pieces that kind of contribute to the puzzle of figuring out where to live and being able to access that housing freely.
Thank you so much. Emily, I want to ask a follow-up there. I mean, so Rashida talked a little bit about some of the changing technologies we're seeing around tenant screening. What are your concerns on the national level for housing? I didn't send her this question in advance, so.
It's a good question. It's a fair question. I think there's a lot of conversation right now in the news about the budget reconciliation process that Congress is moving through. And we can talk about that if we want. And I would say the lesser known conversation that people may not be familiar with is actually the president's budget. There's two things that are happening, right? So there's congressional spending, which is mandatory spending, and then there's the president's budget, which is discretionary spending. And a lot of what's in the president's budget has to do with HUD dollars. And so when we're looking at HUD dollars, we have seen this fight play out year in and year out, where public housing support has increasingly over the past 30, 40 years decreased, and voucher support over the past 30, 40 years has increased. And a lot of that was rooted in who is receiving vouchers versus who is in public housing. And typically, whenever there's a chatter around should we reduce the amount of federal support, dollars-wise, to the voucher program, we have seen a lot of folks rally around the preservation of those dollars. This year is really goes against that trend, where for the first time we're seeing a lot of folks saying, no, we should significantly reduce the amount of money going into the voucher program. And that has a real significant impact, not just nationally, of course, but within the state, because who is ultimately going to have to make up that level of funding? It's a choice that Connecticut lawmakers are then going to have to make. We're not, and it's compounded, of course, because we're not just talking about housing dollars. We're going to be talking about Medicaid dollars, which will be astronomical to the state if this congressional plan moves forward in the way that it's shaping out to be. We're talking about SNAP dollars that the state will potentially have to pick up, because for the first time, Congress is talking about a state match. So just to receive state dollars, the state will have to pay a fee in order to receive those state dollars. Chelsey raised, talking about special education money, right? We're seeing some significant changes within the special education block grants. We are also within the president's budget looking at the way it's presented is they want to block grant Title I dollars, and with that would be a pretty dramatic cut in Title I. That is a massive policy change. Again, Connecticut would have to make the choice in picking up that tab. They add up pretty significantly. So, I think it is TBD. Nothing has been done, but we're paying really close attention, not just on the policy front because of the regressions that we might see, but also on the money front, because we as a state will likely be put in a really hard place, making hard choices about what to fund and what not to fund. No promises have been made by any lawmakers about, we will absolutely preserve X, name the policy. And so that makes a lot of folks really anxious, especially in the field, folks who are working in the sectors that I just, named. And we can talk a little bit about what we're doing. One of the reasons why we are doing a roadshow across the state is to really educate and share knowledge about, what are the options that the state has available in order to really protect residents from deep federal cuts. Because at least our positioning at Voices is, if we are standing still over these next 4 years, that's not progress. There are a lot of sectors within the issues of import that are really asking for, rightfully so, increases in funding, because they haven't seen funding increases in decades. The health field is one of them, right? Medicaid increases have effectively been frozen for many, many years, for decades. So, I think they would argue, and Hospital Association in particular has argued, we need an increase in Medicaid funding. And so if you've got folks who are asking for more money, and we're really having a separate conversation about closing the federal gaps, this is where the options for how do we close these federal gaps comes into play.
Thank you. Chelsey, I'm going to ask you to bring it back home to Waterbury. Again, you spoke, I think, a good deal about housing costs in Waterbury when we first started. Are there other concerns about housing or housing quality, home ownership that you see in Waterbury?
Yeah, absolutely. And I think a lot of it would echo what Rashida mentioned with rising costs, but as you mentioned, quality is also really important. We do a lot of work with Waterbury-led and healthy homes, and so there's a lot of folks who are having to have their homes tested at this point because there may be amounts of lead that are dangerous in these homes, and landlords are not necessarily doing what they need to be doing to take the steps to ensure that these families are safe. There are homes that have flooding that happens when it rains too much, and it gets underneath that cheap laminate that they put in, and that causes mold and other issues where we're having children that are suddenly allergic and have these terrible allergies and are now having medical issues that parents cannot pay for. So there's a lot of different things that our community has voiced to us that are happening within homes that they're already living in. Again, the no cap on the rent increases. Some families are going to renew their leases and they're like, oh, it's going to be an extra $100 for your next lease. And if families can't pay that, then if they haven't had anything in place, then it becomes a month to month, and the month to month is more expensive. And so those things happen as well. I think some other things that we see is also where families can afford housing, which I should say comfortably afford, are not the safest places for their families or for their children. These are places where their children cannot go outside. These are places where their children cannot walk to the corner store that's there. These are places where their cars get broken into. And so families do not want to put themselves and their children in those particular situations. And so then it becomes couch surfing, or it becomes we're now living with mom and 8 other people in a 2-bedroom home because nobody can afford to live outside of the home, especially if they have a car to get around and get their kids to school. This is something else that's added. And so I think the quality, the affordability, the safety, all of that is really a big piece.
Thank you. Yeah, I think we've been kind of circling around some of the interconnectedness of these issues: housing, poverty, education. Who am I going to pick to start this one? Rashida, do you want to start? I'd like to talk a little bit more. What are the other kind of intersections we see issues with housing? Can you tell us about those connections and how policy can better kind of treat these as one interconnected issue rather than bunches of separate fires to put out?
So I am always saying that housing is the bedrock of all of our systems. And I wish we had a counter for how many times I've said that in my career, because I've said it quite a few times. But housing is really the bedrock. It's really the foundation of a whole person, right? Where they're housed, the resources around that, the access, the level of access that they have to those resources is truly, really what shapes our communities. So when I think of housing, and also, it's not just about shelter, it's really just whether a child stays with their family, succeeds in school, or even if they stay healthy, right? Healthcare, education, environmental factors and environmental justice. We're all fighting one fight, right? And I think a lot of the issues that we've been seeing is that all of these different issues have been seen through different lenses in different silos, right? So, if you want to reduce childhood poverty, you really do have to start by treating housing and as healthcare, as education policy, as family preservation, as environmental justice. And I feel like a lot of the policies that we see really do just target just one issue. But recently did a panel with Waterbury Youth Services where we talked about the intersections of environmental justice and fair housing. And one of the things that we found is that the individuals living in places that are not environmentally zoned correctly or environmentally sound has a impact on their housing and their health. And it's so strange to me now that I've been kind of drawn into this world to look at these things as different issues. So I think when we're introducing policy or when we're writing policy, we should always keep in mind that this is all one fight, right? When we talk about housing policy, there should be a provision in there for education. There should be a provision in there for health. We should be making sure that the people who are doing the work and the people who are in the communities experiencing the policy are also at the table when that policy is being written. Because sometimes it's being written for people, but not by people. And that's what I'm starting to kind of learn the further and deeper I get into policy. We really need to make a conscious effort of connecting with the communities that are going to be impacted by that policy. policy, and then doing our individual best to educate people about how to advocate for themselves and to learn more about policy on their own, right? Policy is not boring. A lot of the time people are like, oh, okay, really? That's so boring. Like, SB, HB, all of that stuff, right? But like, honestly, when you put the power in the people's hands to be able to decipher the complicated legislative language and to be able to advocate for themselves, I've seen it in multiple legislative campaigns that we did. You see the fire light in people's eyes when they learn about how these policies are not working for them and how they can advocate for these policies to work for them. So I'm a power to the people type of girl, and I like putting the power back into the hands of the people who are experiencing the disparities. So I think just from our perspective as people who are working in the field, continuously making sure that we are putting out the message that it is all one fight is a good place to start.
You look like you want to say something.
I do, I totally do. So I would provide co-sign everything that was just said, but I also would add a different lens, which is we talk a lot about, we hope that children not just survive but thrive. When we think about that phrase, I would encourage you to think about the Maslow's hierarchy of needs pyramid, right? The thrive piece is actually, academically, it is about creativity, it's about problem solving, it's the place where we know children can actually thrive, can be really self-reliant, self-sufficient, driven, etc. But in order to get there, the very foundation of the need is physiological needs that are met. And that includes shelter, that includes food, and then there's a whole bunch in between, right? So if the bottom is completely cracked, right, really not met, we can't have an expectation that the thrive is going to happen. And so I would just offer that we are a state where we got to really fix in a much more meaningful way the bottom of the needs for kids. We can do it. It just, I think, requires a lot more political will.
Mark, I know you already gave a presentation, but I want to inquire with you, as you're doing these in-depth interviews with folks, are you finding that people are talking about the interconnectedness of these issues, and what are they saying?
Definitely. Sorry, is this working? Yeah, so in the quantitative interviews we do, where we're trying to develop statistical information about each neighborhood and each group, that's structured so it's lots of topics, but it's not a qualitative interview. So we also do the qualitative interview, and that's where people say, their top issue. I think anyone we've done since 2021, all over the state, housing is the top, concern. People's rents, are going up just really rapidly, and, folks are living with family and friends. But then after that, the issues around the responsiveness of government and whether they can reach out to people and try to get those needs addressed is really something that comes up across groups. Like, do they know, how to go to City Hall, how to advocate for legislation? Are there ways for people to come together in the neighborhood to work on issues? That just comes up as a, just almost as high as housing. So people do see the connections between the structure, the civic, the structure of our laws, the access to other resources. I would say, yeah, so, and then there's an intersectionality too, that when you have an open-ended conversation, people bring up the cases of individuals that they know. So I would say, within our housing, one thing I didn't include in the slides, but I usually do is the housing crisis. I think it's really, really extreme in Connecticut. One dimension of the housing crisis is the need for supportive housing. So it's the vouchers, but it's also the special populations that are overlooked. So for example, folks who can't get a subsidized unit because of something in their life experience, or LGBTQ youth who were kicked out of their home, who can't live with their parents anymore. There's very few resources for those individuals. If they're not connected to support, they really do fall through the cracks. So that's something residents often bring up is there might be vouchers, it's really great if you get one, but there are all these individuals kind of missed by the system as well. And that requires an intersectional view of policy and looking at where those gaps are as well.
Yeah, thank you so much. I think we're running a little low on time, so I want to move to talking about legislation. What legislation that just came out of the session are you all excited about? What do you think could have been better? Chelsey, why don't you start?
Sure. So we got some good stuff for early care and education, which was great. We got 5,003 passed, which is amazing, and SB1. So those are some great ones. So 5,003. That creates the Early Start Endowment, so it creates a dedicated funding stream. So by fiscal year 2028, families who are earning below $100,000 have no parent fees for early care and education, and those who are earning above have a 7% cap on those fees. So that's really great to see. And then kind of the main meat of 5,003 is kind of our healthcare subsidy for the child care educators. So they're going to create $300,000 that will be allocated in year one for infrastructure, and then in year two, there's going to be $10 million that will go into a pilot program to help early care educators purchase healthcare on the exchange, which we know is super important because they are extremely burnt out at this point. There's a lot of short staffing. There's a lot of need for mental health, self-care, and all of those things that they're not able to receive due to their wages. And so seeing this come to support the most important people who are cultivating our children is really great to see. But I'll let Emily chime in as well if she has any, because I know she.
Yeah, happy to. So I would just say, before I piggyback off of what Chelsey said, is that when we look at poverty, research tells us there are three big contributing factors to poverty. One is healthcare, the second is federal payroll taxes, and the third is workforce expenses. Within the bucket of workforce expenses, we're talking about an array of things, including but not limited to childcare, transportation, things of that nature. And so when we talk about some of the state wins, yes, Senate Bill 1, 5,003, this was the year for childcare, which is super exciting. I cannot stress enough, it is a big deal. Like it is probably the biggest deal that the state can tout. As really being meaningful to early care within a pretty long time. This is the biggest investment in early care for many years, and I say that because the early childhood advocates have consistently been fighting an uphill battle where they have asked for and without fail been deprioritized year after year. And so this is a very big victory, but after decades of fighting. We did win an expansion on the earned income tax credit. So for families that have at least one child and qualify for the EITC and earning at least $1, they will receive an additional $250 as a result of legislation that was passed this year. And I think it's good. It's not the child tax credit that we wanted. It really kind of offsets any changes that may happen at the federal level, unfortunately. But I think there are other wins, and I'll stop there.
All right, I think it's about time for us to move on to some audience questions. Anybody want to break the ice and get us started?
Towns Take the Lead has passed this legislative session with some edits. I haven't read the amended bill, but I do recognize that there's a little bit more movement on towns being able to build more affordable housing, get up to a certain percentage, and create a plan around that. One of the major organizations that has backed that has been OCA, Open Communities Alliance. And they are currently kind of getting verbiage together to roll out to discuss that in more detail. But there has been some movement, definitely, with the building of more affordable housing. And I believe HB 5002, which is a bill that The title of it is An Act Concerning Housing and the Needs of Homeless Persons, was recently passed, and that tackles exclusionary zoning, makes it a little bit more easy to build those affordable housing units. There are some provisions that we would have liked to add in there, like rental assistance and new housing subsidies, but we take this win. So yeah, that is also something that has been pushed through this legislative session that should have a more positive impact on the building of affordable housing.
In the back? All right, thank you. I think first I would maybe push back a little bit on that data on the spending. There's been a lot of numbers put out. There was a recent study, I believe, from the Yankee Institute that included some education and infrastructure. So the implication was we're spending money for undocumented people to do things like walk on our sidewalks. And I don't think that that's quite equating to what you're asking about. But does anyone feel compelled to tackle that? All right, Mark.
Yeah, so with undocumented immigrants, here for a variety of reasons, one thing to remember is they do work in the workforce at like much higher rates and also generate huge amounts of taxes for like our healthcare system, for our economy, the local spending. Also, many undocumented individuals are married to residents who have legal status, so the idea, disrupting that in some way would affect like families who've lived here their whole lives essentially and their children. So it's a difficult, it's a difficult issue to think about, how do we make everyone better off? But undocumented immigrants contribute like a huge amount to our labor force, our tax base. There should be like immigration policies that are sensible because people come here for so many different reasons, and there's a need to address that for sure. In terms of affecting the Black and Latino communities, you can see from all the data, there's really high needs in the Black and Latino community. Discrimination is still very high. We can see, for something like looking for housing, Black people are like 9 times more likely to say they were, turned down homes because of their race. So those are serious issues. Like everyone needs to work together to address those, have support for, better working conditions, for all communities in our state. So I think everyone can kind of work together to address those, to fight the changes at the federal level that would bring harm to not just people in Waterbury and people of color, but really, most of the low-income population in our state are white individuals in the suburbs too. So they have a lot of interest in the topic as well. But the undocumented population is like about 3% of the state, and you have to remember many of those individuals are like married to residents as well. So it is a difficult topic where it's important to think about all the nuances of that.
All right, thank you. I think we have one more in the front. The question was about whether there's consideration for non-traditional families, so maybe multi-generational, step families, families where maybe the parents are living in different households. So we're going to start with the data. Is that considered?
I love the question. It's certainly, when we talk with residents, like the issues you just raised come up. For example, like if a child moves back with their parent, which seems like something you would do, anytime that if the parent's on a subsidy, they're worried about losing their subsidy, so they have to they sometimes feel like they have to kick out their kids. Like, so all those issues are not really accounted for in the ways our policy are developed. And then in terms of the data, there are ways to break it down to show the non-traditional, like you said, different family types, and describing their needs. It might look very different from the rest of the population. So again, it's a reason to look at people who maybe can't live with their parents for one reason or another, victims of intimate partner violence. All those groups we need to really look at, because what we get from residents is people like that are often falling through the cracks in the system, right? So, but it's I think all of you know more about this as well with your experience too.
I could definitely jump in. So in the work that we do, we also focus on all of the intersections, right? We have protected classes in our state and federally, so we focus on individuals, race, color, national origin, gender identity expression. We focus on individuals who have disabilities, people who are married, people who aren't married. So a lot of the time, a lot of the work that we do is really just focusing on each family, on each case, however that looks, right? There's no, for us, there is no baseline where the services are provided. We are trying to connect with anyone, anywhere that feels as if they're facing discrimination. And we're always very detailed when we're trying to get their stories and understand their cases. So there is definitely consideration and from our end, and we bring that into whatever policy work we're doing as well. So yeah, I love that question because sometimes it can feel like there are people that may get lost in the data, but we are definitely considering all families and individuals in the state.
Anybody else want to weigh in on that question? All right, I think we have another one. I saw orange shirt. So the question is there anything the state is doing to help address chronic absenteeism?
Well, so we both have something to say. I think everybody's really concerned about this because we are certainly seeing it was worrisome pre-pandemic, but it's certainly much more worrisome post-pandemic since it's pretty slow. There have been, there have been districts that have done really innovative things to turn that around. But I think your specific question, this year there's legislation that's included in, I believe, actually, incredibly, the budget bill, the implementer, that speaks to the JJPOC having, the Juvenile Justice Policy and Oversight Committee, having a little bit more oversight over chronic absenteeism. And so that is, I think, a really important transparency measure that the SDE will have to report to the JJPOC in order for them to monitor it much more closely because of the concern, the pretty broad concern that folks have around the numbers.
And so some of the things that we're seeing is our organization works in the pre-K through 8 schools in Waterbury. So that gives you Wendell Cross, Reed, Carrington, Duggan, Roberto Clemente, and I'm missing one, Gilmartin. And so with our chronic absenteeism rates, we're seeing mostly pre-K kindergarten area. And again, that has a lot to do with the transportation. There's no pre-K busing in Waterbury, and these schools are walkable schools, but again, not safe walkable schools. The sidewalks are not sufficient, things like that. So those are some of the things that are contributing to it. As far as them being able to tackle the issue, I know our site coordinators are working on ways and trying to think about creative ways that they can innovate that. But for example, there are attendance counselors, but they may be subbing for other teachers, or they may be doing lunch rounds, or they may be doing something else where they're not really able to take that time and commit to making sure that those families are able to, answer the phone or call them or whatever it may take, because there are some districts that do door knocking. There are some districts that do, more enforcement around that. But I just think here in Waterbury, and what I've been seeing, there's not enough staff to really account for that issue. And I think that the local level needs to do more. I know there's us and there's other community organizations that are looking at it, Waterbury Youth Services, us and truancy folks, but I just think that the overall school system needs to do more.
All right, I'm gonna close this out with a quick question. answer as quickly as we can because I think we're running low on time. But I do want to kind of leave folks with some action items. So what are things that communities, local leaders, and the folks in this room today can do to advocate for the policies they want to see in their communities?
So I think a lot of what Rashida mentioned earlier, which is putting the power back to our folks, we see that works very well with our parents too. Awareness, education, and then kind of if there's a way for you to decrease those barriers of parents getting that information, then that's helpful. So for example, when we had Rashida come out and talk about housing rights, right, to our parents, we want to make sure that we have childcare if they need to bring their children. We want to make sure that dinner is available because we know it's after hours. So just thinking of ways that you can accommodate the people in your community while also being able to give them that knowledge and then also give them a call to action at the end. Here's what we got and here's what we're going to do next. And I think that that's something that's worked really well for our organization.
And piggybacking off of that, mutual aid works, and you don't have to wait for a sweeping policy change to be able to take action, right? You could take action today. You could take action as soon as you leave this place, right? There's a multitude of different organizations, of individuals who are doing good work in this room. Network, see what they're doing and see how you can connect with them and they can help lift up what you're doing and how you can lift up what they're doing, right? We don't have to wait until the next legislative session to start looking into solutions. We could start actually doing that today, right? So get in touch with people who are doing good work and see how you can work with them and how you can lend your expertise to them and how they can lend their expertise to you.
I mean, we kind of started this conversation around a chuckle around teeth and how we love our teeth, but I'll go full circle here. I would argue that the reason why we have more people engaged in dental care is because there was a concerted effort among organizations and advocates to really knit together the importance of dental care with whole body care, right? If something happens in your mouth and it becomes septic, right, it infects your whole body. And so that is, I think, illustrative of it starts with knowledge. And then I think this space is a really great start. I would say engage your legislators directly and tell them what's important to you, tell them what you're worried about, engage us as organizations. I think the big fight moving forward is certainly going to be policy very specifically, but I really think the fight is going to be around resources. This state is going to have a real reckoning around what to fund and what not to fund. And I would just leave us with this idea that it is really important to care for all of our children because harm to anyone is actually going to come back to us no matter what. We are paying for harm to our children no matter what. And so I think it is incumbent upon us to think about how do we support, regardless of, irrespective of immigration status, irrespective of race, how do we support all of our children and families?
And one thing that's really impressive is how much knowledge there is within communities, like small groups of residents getting together. One thing we hear from residents is they don't always have opportunities to get together for different reasons, and they want more of those. So the more folks can do to, create places where people can gather, to have, places where people can talk about their neighborhood and help each other. There's the mutual aid concept is something that a lot of people tell us that they want more of. So.
All right. Thanks. We'll wrap up now out of respect for everybody's time, but Foundation staff and I think some of our speakers will be around afterwards if you want to chat. Otherwise, if you have to run and you have questions, comments, you have a feedback form, or you can be in touch with the Foundation. Thanks to the Foundation for setting this up and to our panelists, and I'll turn it back to Kathy.
And, it's funny because I knew we would talk about a lot of things today. I did not know we would talk about teeth. I like my teeth, so. But really, thank you to our panelists, Chelsey, Emily, Mark, Rashida, for your honesty, your expertise, and your unwavering commitment to children and families. Thank you to our moderator, Ginny, for your brilliant questions and ability to moderate a thoughtful conversation. And thank you to everyone in the room for showing up, not just physically, but also with open minds and open hearts. Today's conversation was sobering. The data is clear. Still, far too many children in our state are growing up without the things that they need. But today has also shown us something. It has made it abundantly clear that poverty is not inevitable. To Emily's last point regarding the dental care, that didn't happen by accident. It happened because it was a group of people who came together to work together to make that change. And so when we think about childhood poverty, it is not a natural condition. It is a policy choice. And we need to be very clear about that we have made policies that have resulted in what we see right now. And for me, that's uncomfortable. And I hope for all of you that that's also uncomfortable, because we can advocate for different choices. At Connecticut Community Foundation, we see the extraordinary work being done every day by so many of our nonprofits. We fund it, we advocate for it, and we convene around it. But we also know that we cannot fund or program our way out of this alone. Ending childhood poverty really does require a bold public will, a cross-section collaboration, as well as a deep commitment to equity. So what's one concrete action? So Ginny didn't ask me the question, but I'm going to answer it. So one of the things, if you represent a nonprofit, if you know people who represent a nonprofit, please go on and take the pledge, the End Childhood Poverty Now. It started in Eastern Connecticut, quickly realized that it is not about ending childhood poverty in the eastern part of the state. It has to be the entirety of the state. And yet it is still not as many organizations as we would like that have signed on. And the signing on is not just a pledge, right? You're not just signing your organization's name. What you're actually doing is supporting policies, and it's 4 policy changes. It is to support a permanent refundable Connecticut child tax credit at the $600 level. We did not get that done yet, so it is still work to do. So some people may be applauding after the legislative session. It's still a lot more saying, you know, not only do we have to keep the ground, we have to make more ground. The pledge is also about supporting universal no-cost healthy school meals for food insecurity. It is also about expanding good cause eviction protections to support family and their housing stability. And it also supports the creation of a universal child care system. Why this is important, why this pledge is important, is because when it was developed knowing that you just can't fight for your piece of the action over here. That you just can't do housing, and you just can't do education, and you just can't do child care, and you just can't do health care. That if these things are not connected in one packet, what will happen? The legislators will divide us, and they will make us fight, and they will make us fight for resources. So we have to come in together as a peer, as a true partnership. The other thing that we can do is we can advocate for policies that make a difference. We can give to causes that support children and families. And we have to remember that housing and transportation and health care and child care, they are all connected. And we have to be able to hold those things in our hand. And we have to be able to recognize the connective tissue between those systems. They connect us. They impact our children and our families, our community, our state in profound ways. And let's also remember Lincoln's Gettysburg Address, You all can probably tell I enjoyed history. We are a government of the people, by the people, and for the people. And so I leave you with this challenge and this hope. Let's not let this conversation end here. Let's carry it forward into boardrooms and classrooms, into policy meetings, and kitchen table conversations. Let's ask, what would it look like if every decision we made truly centered the well-being of children and families? Because again, child poverty is not a foregone conclusion. It is something we have the power to end through courage, collaboration, and conviction that every child deserves to flourish. We are not starting from scratch. We have all of the ingredients. Mark has given us the data. We know the things that work. We know the policies that work. And so the ideas are here. The will is growing to do more, and the future is not written. Instead, it is waiting on all of us. So let's make sure that we write one that is worthy for all of our children. Thank you all for coming. We hope you all stick around. Remember, I promised that the food would still be there. I've been in here with you all, so I hope that remains true. But please stick around. If you do have to go, please keep the conversation going. When you see things on the Connecticut Community Foundation's Facebook page, please share them. I may have 1,000 friends, you may have 2,000 friends, someone else may have 50 friends, but I guarantee you some of those friends may overlap, but some of those friends are different. And so let's really keep the conversation going, keep our advocacy going, and for those who have to leave, have a wonderful Friday. Thank you for coming. For those who get to stay, I will see you all over across the hall. Thank you again.